Do you know we have a tissue which is more like a bone in our tooth? Amazing, right? And do you know how it is formed? If no, then you are a right place to know about this thing. So let's get started. So the tissue I am talking is nothing but dentin. Yes, you heard right. It is dentin which is more like a bone and present in tooth. Okay, so let's get started to the topic. Today we will be learning about the dentin, which is a very important part of tooth and which is responsible for tooth sensitivity, pain also. Okay, so like any other tissues like enamel or the pulp, it has some physical and chemical properties also. So let's get into physical and chemical properties of dentin. The color changes with age. In younger individuals, it is very light yellow, and with age, it darkens in color. Okay, so the hardness is in between the enamel and the bone, but it is harder than bone, softer than enamel. Okay, then the thickness is more on the buccal side and compared to the lingual side. Mesial distal has the equal thickness of dentin. Buccal, why? Because the more forces are acting on the buccal side compared to the lingual side. Okay, then coming to the hardness, it is more harder than in the central part, which is very near to the pulp or at periphery of the pulp. Okay, hardness of dentin is more in the permanent than in the primary or the deciduous stage. Okay, then it is more radiolucent than enamel, means it appears more darker in color. As you can see here, this is the enamel portion, this the opaque or dark white color is enamel, and this portion is dentin. Okay, so it is more radiolucent than the enamel. Why? Because of the content it has less inorganic content compared to the enamel, so it appears more radiolucent than the enamel. Okay, as we know, enamel has 96% of inorganic portion, which renders it radio opacity. Okay, but the dentin has 65% inorganic portion and 35% of organic matter plus water. And enamel has 96% of inorganic plus 4% of organic with water. Okay. Then inorganic substances or organic portion, the dentin has the collagen fibers. Collagen fiber is very important part of any tissues, either is the pulp or the PDA. Okay, so collagen fiber and the ground substance is has it has a collagen fibers and the ground substance. Okay, so in ground substance we have the proteoglycans and glycosaminoglycans. Remember, these points are very important. Ground substance has proteoglycans and glycosaminoglycans. Not only in dentin, the ground substance, in any other tissues, the ground substance is mostly the glycosaminoglycans, which is abbreviated, or the short form is glycosaminoglycans, GAG. So remember the short forms here. Okay, so as we will be using these short forms more frequently. Okay, so proteoglycans part contains chondroitin sulfate and decurin biglycan. So chondroitin sulfate is important portion of proteoglycans, as it renders the hardness to, yes, it renders the hardness to dentin. Okay, and the glycoprotein portion contains dentin sialoprotein, dentin phosphoprotein, phospholipids, and osteonectin also. Okay, apart from this, some growth factors are also present. Why? Because odontoblasts are present near the pulp chamber, or as you can see, it is a layer of pulp. Okay, odontoblast. So for their growth, dentin has some growth factors like transforming growth factor and fibroblast growth factors, insulin-like growth factors, bone morphogenic proteins, platelet-derived growth factors, etc. Okay, and inorganic substance contain hydroxyapatite crystals, phosphates, sulfates, and carbonates. Hydroxyapatite crystals is common in both enamel and dentin. Okay, then moving to the next. So what does dentin have? Apart from its inorganic and organic portion, dentin has some structure too, like enamel, which has the enamel rod. Same as dentin has some or the other structures. It has a predentin layer. Okay, it has a predentin layer. It has dentinal tubules, which is important. Dentinal tubule is the structure unit of dentin. Remember this point. Okay, it has a peritubular dentin. It has an intertubular dentin. It has a globular dentin. Okay, now we will discuss this one by one. First, we will discuss about the pre-dentin. As the name is suggesting, pre means first or the prior. Pre-dentin. Before the layer of the hard dentin is formed, a first layer of pre-dentin is formed by the odontoblast, which is very near to the pulp. Okay, as you can see, this is the pulp portion. Okay, this is a pulp portion. Okay, this has a line or the junction between the pulp and the dentin, pulpodentinal junction. Okay, and this layer, which is very faint pink color, this layer is pre-dentin. Okay, and after that this has a dentin layer. Okay, so the first layer of dentin which is formed by the odontoblast is known as the pre-dentin. Okay, it is located always adjacent to the pulpal tissue. Why? Because odontoblast form this layer, and odontoblast layer is one of the layer of pulp. Okay, it is not mineralized. It is not mineralized. Okay, it appears as a pale staining, then the mineralized dentin. As you can see here, it has a very faint pink color compared to the dentin proper. Okay, as collagen fibers undergo mineralization at pre-dentin and dentin junction, this is pre-dentin and dentin junction. As you can see here, this is pre-dentin and dentin junction. So the collagen fibers undergo mineralization here, and the pre-dentin layer become the dentin, and the new layer of dentin, pre-dentin is formed, which is circumpulpally present. Okay. Then moving to the dentinal tuberous, which is the structural unit of dentin. It has a course which follows a gentle curve in crown, less in the root. Okay, it has a sigmoid or S-shaped curve. Primary curvature, it has a S-shaped or sigmoid course. Okay, it has a primary and secondary curvatures. So primary curvature, which is S-shaped. As you can see here, this is S-shaped. Okay, this is the primary curvature. Starting at right angle from the pulp. This is the pulpal space. Okay, and it starts at right angles to the pulpal surface. And first convexity of this doubly curved course. As you can see, this is one curve and this is the second curve. Okay, so it is a doubly curved double curve it has. Okay, so the double curve first convexity here is directed towards the apex of the tooth. Okay, as you can see, this is facing towards the root portion, and this is facing towards the crown portion. Okay, remember this point. Oh, important. Tubules end perpendicular to DEJ and DCJ. What is DEJ? DEJ is nothing but dentino-enamel junction, and DCJ is nothing but dentino-cemental junction. As you can see here, at this portion, this is dentino. Yes, here this is dentino-enamel junction, and this is dentino-cemental junction. Okay. Okay, yes. So it has some terminal branches also. Terminal branches are branches of tubules near their terminals. This is first terminal here, and this is the second terminal here. So it has some lateral or the terminal branches at these portions. Okay, tubules are straight along the incisal cusp and the cuspal incisal edges and the cuspal. Okay, then secondary curvatures. The entire length of tubule exhibit minute relative regular curvatures, which is sinusoidal in shape. Okay, as you can see here, this is a doubly curved course. It has a terminal branches here and here. This is the enamel portion. Okay, and this is at the pulpal portion. Okay, apart from that, it has some lateral branches also, which are secondary curvatures. Okay, more close near the pulp and farther in the periphery. Obvious, more tubules per area in crown than the root. And canalifier, the macrotubules are lateral branches of dentin tubules throughout the dentin. Okay, then enamel spindle. What is enamel spindle? Enamel spindle is we can see this in enamel also, in a hypocalcified structure of enamel also. Enamel spindle is nothing but the terminal portions of this odontoblast or the few odontoblast process which extend the dentino-enamel junctions. As you can see here, this is our dentino-enamel junction. This is enamel. Okay, this is enamel and this is dentin portion. And as you can see here, these minute structures are nothing but the dentinal tubules. Dentinal tubules contain odontoblastic processes. If those odontoblastic processes just cross the dentino-enamel junction and enters into the dentin, it forms the enamel spindle. Okay, next, moving to the peritubular dentin. It has a peritubular dentin and intertubular dentin also. Okay, peri means at the periphery or surrounding. Okay, tubular means tubular is nothing but the dentinal tubules. So the dentin which is present around the dentin tubules is called as peritubular dentin. As you can see, these black holes are nothing but the dentinal tubules. Okay, and the portion which is surrounding it, this portion calcified structure is nothing but peritubular dentin. Okay, so dentin that immediately surround the dentinal tubules is called as peritubular dentin, and it forms the walls of tubules in all but dentin near the pulp. Okay, because there it is very less calcified, more mineralized than the interglobular dentin, and also called as the intratubular dentin. And periodontoblastic space is nothing but the space between this odontoblastic process and the peritubular dentin. This space is called as a peritubular or periodontoblastic space. Okay, it contains the dentinal fluids. Okay, then moving to the intertubular dentin. Intertubular dentin is nothing but this is one tubule, dentin tubule, this is second dentin tubule. The dentin present between these two tubules is called as intertubular dentin. Inter is means in between that two. Okay, it forms the main body of dentin and is located between the dentin and tubules. It is highly mineralized compared to the intratubular or peritubular dentin, and it retains after decalcification because it has high mineral content. Okay, and half of its volume is organic matrix mainly composed of collagen fibers, and hydroxyapatite crystals are formed along the fibers with their long axis parallel to the collagen fibers. Okay, and what it is telling is that if this is our dentinal tubule, okay, if it is our dentinal tubule, it has hydroxyapatite crystals and some fibers also. So the fibers are parallel to, yes, the hydroxyapatite crystals. Then moving to the odontoblastic process. Odontoblastic process is important because they are generating or originating from the odontoblast, which are nothing but dentin forming cells. So odontoblastic process is nothing but the cytoplasmic extensions of odontoblast. As you can see in this diagram, these are nothing but odontoblast. Okay, as you can see, this is odontoblast. Okay, and the process extending from it is odontoblastic process. Okay, cytoplasmic extensions. As you can see, there is no interruptions between the process and the cell. Okay, so it is a cytoplasmic extension of odontoblast. Odontoblastic cells reside in peripheral pulp at pulp predentin border, and the process extend into dentinal tubules. Okay, this is important point. Okay, odontoblast cell reside near the pulp. So this is the pulpal portion. This pink portion here, till here it is a pulp portion. It is pulp and predentin junction. So the odontoblast retain near the pulpal portion, and the extensions are extending to dentin. Okay, it contains microtubules and small filaments. They divide near the DEJ, dento-enamel junction, and may extend into enamel, with known as enamel spindle, as I have told. Okay. Then next, moving to the types of dentin. There are three types of dentin: primary dentin, secondary dentin, and tertiary dentin. Okay, these three are important. Primary dentin is, it is implying the name itself. Okay, first form dentin is primary dentin. Secondary dentin is after the primary, and tertiary is in response to external stimuli. Okay, moving to the primary dentin. It is formed before the root completion. These points are important. Remember these points. Okay, So primary dentin is formed before the root is completed. And it is of two types, mantle dentin and circumpulpal dentin. Okay. So what is mantle dentin? As you can see here, this is the portion. This is the dentinoenamel junction. Okay. And this portion is the mantle dentin. And it is interglobular dentin. Interglobular dentin is in between the dentinal tubules. It is like an island of calcification. Okay. So what is mantle dentin? It is first formed dentin in the crown under the DEJ. This is dentinoenamel junction. Okay, this is the dentinoenamel junction, and the first layer of dentin which is formed just beneath the dentinoenamel junction is mantle dentin, and it is formed before the root is completed, and it is soft, means the mineral content is less, and it provides cushioning effect to the tooth because of its softness and less mineralization. Okay, outer of the most peripheral part of the primary dentin is mantle dentin. It contains a larger diameter of collagen fibers which are argyrophilic and known as cross fibers. Okay, remember this point, cross fiber are important. And what is argyrophilic? Argyrophilic means the fibers or the substance which is stained by the silver. Okay, which is stained by the silver, Ag. This is symbol for silver. Okay, then it is less mineralized compared to coming to the circumpulpal dentin. It forms the bulk of tooth. Okay, and the collagen fibers are smaller in diameter, which are more closely packed compared to the mantle dentin, and it is slightly more mineralized compared to the mantle dentin. Okay, circumpulpal. Circumpulpal is nothing but, if this is the pulpal portion and this is the dentinal portion, so the dentin which is present near the pulp is known as circumpulpal dentin. And suppose this is the enamel and this is the dentinoenamel junction, so the dentin which is present here is mantle dentin. Okay, next, moving to the secondary dentin. As you can see here, this is the pulp portion. Okay, this is the pulp portion and this is the dentinal portion. So primary is here, which is dark in color, and secondary is here, okay, which is very light compared to the primary. So it has a narrow band of dentin bordering the pulp and representing that the dentin formed after the root completion. These points are important. Primary dentin is formed before the root is completed and the secondary is formed after the root is completed. Okay, contains fewer tubules than the primary dentin, and it is formed more slowly than the primary, not formed uniformly, appear in greater amount on roof and floor of coronal pulp chamber, and protects pulp from the exposure in the older tooth. Okay, so it has a regenerative property, you can say. Then so coming to the tertiary dentin, which is formed in response to noxious stimuli. Okay, so it has a reparative, responsive, or the reactive dentin as other names. It is localized formation of dentin on the pulp dentin border. Okay, and it is formed in reaction to the trauma such as caries or the restorative procedure. So it has a regenerative property. Okay, it is formed due to the external stimuli. In this diagram, as you can see here, the pink portion is nothing but the pulp. Okay, this is the pulp portion. This is dentin portion and this is enamel. Okay, as you can see in the diagram. So we place some sedative medicament or the cement over the pulpodentinal junction to to stimulate the formation of tertiary dentin. Okay, so we mostly use the calcium hydroxide cement as a medicament to stimulate the formation of tertiary dentin. We use calcium hydroxide. Okay, it has a sedative property and it has a property to regenerate the tissues. Calcium hydroxide, we most commonly use this. Okay, so we place the calcium hydroxide over the pulpodentinal junction, and after that we place a filling. The procedure is different, but for short term I am telling this. Okay, so the placement of this cement stimulate the odontoblastic layer of pulp, which regenerate the dentin, which is known as the tertiary dentin. Okay, now What is interglobular dentin? Interglobular dentin, it is formed when the mineralization of dentin begins in small globular areas that fails to coalesce into the homogeneous mass. Means the dentin is not formed uniformly, and the dentin is formed in globules or the islands of mineral tissues which does not get united with each other, is known as the interglobular dentin, and it is a zone of hypomineralization between the globules. Okay, so in short term, it is the hypomineralized form or the areas in the dentin. Okay, it follows incremental lines. What is incremental lines? Means the dentin is not formed uniformly, okay, and with a regular period of time. Okay, so dentin is formed in increments, like this much dentin is formed in so and so duration. Is due to that the lines are formed which shows the difference between the mineralization, so it is known as the incremental lines. So the interglobular dentin follows the incremental lines. Okay, defect of mineralization, not matrix formation, as dentin tubule passes uninterrupted through it. So it is a defect of mineralization, means the mineralization has not occurred between this portion, or remember this point, okay, it is a defect of mineralization, it is not the defect of matrix formation. Why? Because the dentinal tubules easily pass through them, so it is the defect of mineralization, not matrix formation. So occurs most commonly in the cervical and the middle thirds, followed by the intercuspal and the coronal thread in the crown. So they are more common, or the more commonly they present near the pulp portion or the cervical and the middle portion compared to intercuspal or the coronal thread of the crown. As you can see, the dark portions here, they are the interglobular dentin. Okay, here faint pink color, they are interglobular dentin. So these globules does not coalesce or does not united with each other. Okay, then moving to incremental line. Well, as I have told, the dentin is not formed uniformly, it is formed in increments. So the line which demarcate that increment is nothing but the incremental line. So for in dentin, enamel and cementum, the portion is formed differently different times, the lines are formed. So we have given them different names for identification. Okay, so the incremental lines of dentin is known as von Ebner line. Remember this one, von Ebner line. Okay, so they run at right angles to the dentinal tubules, means they are parallel to the pulpal surface. It corresponds to the incremental lines in enamel or the bone, and cementum too. Okay, reflects daily rhythmic recurrent deposition of dentin matrix, and distance between the two lines is 4 to 6 micrometer in ground, and it is less in yes, the distance between the incremental line is less in root portion. Okay, daily increment decreases after tooth reaches to the functional occlusion, means the occlusion, if the occlusion is established, the increment decreases, the formation of dentin is slows down. Okay, course of line indicate the pattern of dentin form. Okay, as you can see here, this portion is dentin and this portion is enamel. So, and this is the dentino enamel junction. Okay, so as you can see, very faint line here, yes, brown, faint brown line here, that line, yes, differentiate or distinguish between the dentin which yes, for enamel I am telling this prenatal and the postnatal. For example, I am telling, okay, that line differentiate or distinguishes prenatal and the postnatal enamel formations, and it is known as a neonatal line. Okay, same in the dentin, as you can see here, this is for cementum, contour line of O1. One emblem is for, yes, this is, yes, this is in light, either transmitted or reflected light. As you can see here, very light yellow colors, it shows the incremental lines. So it is perpendicular to the dentinal tubules. Okay, these lines are called as incremental lines of von Ebner. Contour lines of oven are nothing but accentuated incremental lines because of disturbance in the matrix in the mineralization process. As I have told, yes, okay, we have different names for different incremental lines. If the contour line of von Ebner, which is incremental line of dentin, it is accentuated, like it is darkened, okay, or deepened because of matrix and mineralization process disturbances. The line which is seen is called as contour line of Owen. Okay, and neonatal line which differentiate, as I have told for dentin enamel, same as in dentin. Okay, neonatal line which differentiate the dentin which is formed before birth and after birth. Okay, so it is accentuated contour lines formed when the dentin is formed partly before and after birth. It separates the prenatal and the postnatal dentin and reflects abrupt change in environment that occurs at the birth. Okay. Then moving to the granular layer. This portion we have in root, not in crown. Remember this point, okay? So it is known as Stone's granular layer. Dry ground section of the root dentin are visualized in transmitted light. A zone adjacent to cementer appears as a granula, which is known as the Tomb's granular layer. As you can see here, like a salt, or you can say as a sand, whatever you say, but this black small pinpoint line is called as Tomb's granular layer, which is seen in the root portion only. Remember this point, okay? And it is caused by coalescence and looping of terminal portions of dentinal tubules. Remember this point also, okay? Then moving to the innervation of dentin. Like any other tissues, dentin is also supplied by some nerves, okay? So it is intratubular nerves. Intratubular means in between the tubules, not in between two tubules, it is within single tube. Okay, it is intratubular dentin. They interdigitate with odontoblastic process, indicating intimate relationship to this cell. Okay, so they are more closely attached or present with odontoblastic process. As you can see here, yes, in this diagram, as you can see here, this is odontoblast. Okay, and this is odontoblastic process. So this is nerve, which is intratubular nerve. So it is more closely attached to the odontoblast. Okay. Then theories of pain transmissions through the dentin. This is very important. It has been asked many times in your examinations, and in Viva also we asked these questions. So theories of pain transmissions, like how dentin react towards the pain and what causes the pain sensation to dentin. Okay. So there are different theories. We will discuss them right now. First theory is direct neural stimulations. According to this theory, nerves in dentin get stimulated whenever any external stimuli, either it is caries or any hard subject, hard things you bite, okay, or any cold or hot thing you take. So that stimulate the nerves according to this theory. Okay, the topical application of LA does not abolish sensitivity, hence this theory is not accepted. Means as you can as we have told ki any external stimuli which causes the disturbance between the dentin causes the stimulation of the nerve, but LA, which is local anesthesia, if we apply it to the tooth, the pain doesn't go. Okay, it doesn't abolish the sensitivity or the pain. It doesn't abolished after application of LA. So this theory is discarded. Then coming to the next theory, the fluid or the hydrodynamic theory. It is most popular theory, and various stimuli such as heat, cold, air blast affect fluid movement in dentinal tubules. Okay, fluid or the hydrodynamic theory means the dentin has, yes, dentinal fluid. If any changes or any disturbance occurs to that fluid, the pain or the sensitivity occurs. So this theory is most accepted or the most popular theory. Then coming to third theory, which is transduction theory. According to this theory, presumes that odontoblast processes primary structure excited by stimuli. Means the odontoblast is the first structure which gets stimulated when any external stimuli affects it. And it is not accepted because odontoblastic processes are present, or odontoblast is present near the pulp. But we are talking about the dentin. Okay. So transduction theory is also discarded. So the most commonly trusted theory is fluid or the hydrodynamic theory. Okay. Next, the dentin permeability and the age changes, like how the age affect the dentin. So dentin permeability depends on the patency of the dentinal tubules, obviously, and the reduction in dentin permeability lessens the dentin sensitivity. Means if the dentinal tubules get obstructed or it gets mineralized or the permeability of that changes, the sensitivity also changes. So dentin is laid down throughout the life termed as the secondary dentin. Okay, tertiary dentin is just for protection. It, if formed as a result of pathological process like caries, it is termed as a tertiary dentin. Okay, and dead traps. It is formed when the dentinal tubules degenerate due to the injury. Dead traps. As you can see, the black portion here, this is the dead traps. Means if any caries or any attrition, abrasion. Attrition is nothing but due to the wear of enamel. Like due to the constant grinding of tooth, the enamel portion wears off. It's known as attrition. Okay. So if due to the attrition, abrasion or any other pathological habit, the enamel wears off and the dentin is stimulated and the dentinal tubules get degenerated due to that stimuli, the dead tract is formed. Okay. And what is sclerotic dentin? It is mineralization of dentinal tubules. Sclerotic dentin means the mineral is deposited within the dentinal tubules, is known as sclerotic dentin. As you can see here, this portion, which is very light pink color, this portion is known as sclerotic dentin because the dentinal tubules gets mineralized here and the dentinal tubules gets degenerated here in dead tracts. Okay, remember this one. Okay, dead tracts mein dentinal tubules get degenerated due to any external stimuli which is pathologic. Okay, not normal. And in sclerotic dentin, where the dentinal tubules get mineralized. Okay. Next, development of dentin. How the dentin is formed? As we know, enamel is formed due to the enamel rods. Dentin, how it is developed? So it is dentinogenesis. As enamelogenesis, we have dentinogenesis. Okay, it begins at the cusp tip. Dentinogenesis begins at the cusp tip, and the fibronectin, decorin, laminin, which are the ground substances of dentin, the chondroitin sulfate may be involved, and some growth factor like TGF, IGF, BMP are released from the inner enamel epithelium and taken by the pre-odontoblast. Odontoblast differentiate from the ovoid to columnar shape and nuclei become basally oriented. And the process arises from the apical end of the cell. And radicular dentin formation is slower than the coronal dentin. These points are theory based. You need to remember these points. Okay, like how the odontoblast first, then how they differentiated, where is the nucleus and all. Okay. Mineralization. General classification process is gradual, like it is in increments. Okay, and apatite crystals resemble bone and cementum crystals. Apatite crystals, hydroxyapatite crystals. Okay. Then the clinical considerations, like the changes which occur over a period of time. So dentinal tubules provide passage for invading bacteria and their toxins through the dentinal layer and enlarged by destructive actions of microorganisms. Means the dentinal tubules give a pathway for spread of dental caries. As you can see here, this is the dentin portion. This is the dentinal portion. Dentin portion, and this is the enamel portion. Okay, so dentinal portion has the dentinal tubules, like you can see here, a black line we have. So if any stimuli or any caries which are present in enamel, if they spread to the dentin, the dentinal tubules give the pathway for microorganism to spread. And undue trauma from operative instrument also damage the pulp and also dentin. Because we have a minimal thickness of dentin, if we exceed that dentin or if the caries exceed that minimal thickness, there are chances that pulp get exposed or yes, the pain will start. Dentin sensitivity is less seen more in patients with periodontal problems because of cementum also. An erosion of peritubular dentin accounts for the dentin hypersensitivity caused by agents like acidic soft drink. Erosion is nothing but, as I have told, attrition is wearing of the enamel surface. Erosion is due to the acid content, like you take soft drinks, cold drinks, or any acidic beverages, lime, etc. And even sport drinks also. It causes the erosion of or the sloughing of the enamel surface, which causes, yes, which causes the dentinal tubules to get exposed. Brushing after acidic consumption reduces sensitivity. Means after you take like you take any food, if you do proper brushing, the reside of that food or juices will get off, and the chances of getting erosions or any dental exposures or sensitivity, it's reduced. Okay, first line of treatment for sensitivity is use of dentifrices containing the potassium nitrate or stannous fluoride. This is clinical consideration, like we use the toothpaste which contains the potassium nitrate or the stannous fluoride to reduce the sensitivity. Okay, smear layer consists of cut dentin surface along with embedded bacteria and debris. It prevents adhesion of restorative material to dentin. It has to be removed by etching or the bonding agent to penetrate. This is important. Okay, what is smear layer? Smear layer consists of dentin, which is cut off, and with bacteria and food debris also. So we have to remove this smear layer, because if we did not remove this smear layer, the restorative material will get not attached to the tooth structure or will not adhere to the tooth structure. Okay, so we have to remove this smear layer by use of etchant. Okay. Yes, so that was all about the dentin, how it is formed, the structure it contains, different types of dentin, the clinical considerations, how the sensitivity occurs, and how we prevent it. Okay, so hope you people have liked this video. If you did, just share this video with your fellow colleagues too, so this might be helpful them for them also. Okay, so and subscribe to the channel for more such updates, and just comment down if you need any particular topic. Okay, so until then, take care. Thank you.